Hi. So we are in the last segment for the drugs used for arrhythmias, and this is a very, very brief lecture. I'm just going to summarize that for what particular type of arrhythmias, which drugs are preferred. Okay, so it's just a summary of all this. It'll take just few minutes. Okay, but this will actually, in one glance, give you an idea कि कोई question अगर आता है exam में, so what you're supposed to write about that, right? So this is the heart here we see. And see, arrhythmias means there is a change in the from the normal rhythm. So it can occur from any site, right? If it is a change in the activity of the SA node, so bradycardia, tachycardia, then any increase in the excitability or change in rhythm of the atria. Okay, so we can have basically it is actually a lot of impulses being generated from the SA node and they give rise to atrial flutter, atrial fibrillation, or anything which occurs above the level of the AV node. It is supraventricular tachycardias. Then AV node का importance है because it helps in the conduction of impulses from the atria to the ventricle. So agar all the impulses are conducted from atria to the ventricle, so definitely in the ventricles it will lead to increase in the rate and rhythm, okay, of this ventricular firing. So it will be like ventricular tachycardia, ventricular fibrillation, which is very dangerous, which can lead to death of the patient. So we, the anomalies can be present anywhere, and we have to target these anomalies. So the first one that we're going to talk about is for the SA node. Or agar there is increased firing from the SA node or decreased firing. So this is sinus tachycardia, increase in the firing, and sinus bradycardia, that is decrease in the firing. So if there is a sinus tachycardia, you can give a drug like propranolol. We know that propranolol is a beta blocker. Beta 1 को block करेगा in the heart, and जब beta 1 block होता है तो क्या होता है? Decrease in the heart rate and decrease in the force of contractions. So this is effective in sinus tachycardia. But अगर bradycardia already decreased है, that means the cholinergic activity ज़्यादा है. That is leading to bradycardia. You know that vagus effect ज़्यादा है. तो हम cholinergic activity को we will try to oppose this by giving anticholinergics. And what is the anticholinergic? The muscarinic blocker that we give, that is atropine. Or we can also do temporary, we can give put a pacemaker, artificial pacemaker, which will generate the heart rate. All right, this is this one. Now, paroxysmal supraventricular tachycardia, something which is originating above the ventricles, can originate anywhere above the ventricles. So we don't, iska main aim kya hai? We don't want those impulses to pass to the ventricles. So the best, we have two medication, drugs, which are the calcium channel blocker, that is verapamil and adenosine. These two are the first line drugs for paroxysmal supraventricular tachycardia. Then we can also, other drugs which can be given is propranolol, and we can give myoderone. Okay, so we can give these drugs. Atrial flutter or fibrillation depend very, very high heart rate, atrial rate is very high, and the main aim is basically first you need to control the rate. हमें rate को decrease करना है पहले, और उसके बाद हमें atrial के rhythm को ठीक करना है. So we have to control the rhythm. So rate of firing and then the rhythm. So firing usually किससे कम होती है? We give drugs like propranolol, and the SA node or the AV node, इनमें दोनों में important है calcium channels, so we can give verapamil. These are there to control the rate, which is of prime importance in this. सबसे पहले हम rate ही control करेंगे, उसके बाद हम बाकी drugs देंगे जो rhythm को control करेगी. For example, amiodarone, So amiodarone हो गई, then ebutalide, right, and dofetilide, and you can also give procainamide. Okay. So these drugs are very effective, and ibutalide is one drug which will control or will change the atrial this rate into a sinus rhythm. बाकी सारे सिर्फ prevent करते हैं its movement into the passage of impulses into the ventricles, while ibutalide it converts it into a sinus rhythm. ठीक है? Then we go further down. We go into the ventricles now. So first we can have ventricular tachycardia. So the drugs which are effective for ventricle, which especially they act on ventricles, that's sodium channel blockers like lignocaine, preferably here, and even amiodarone. They're very effective in ventricular tachycardia. Even for ventricular fibrillation, हम same drugs use करते हैं. But therapy of choice, because emergency है, हम सबसे पहले we can use defibrillator. That's a therapy of choice. Defibrillation by defibrillator. Torsades de pointis का जो treatment है, we give magnesium. It is very effective against Torsades de pointis. We can also use lignocaine. Actually, should come here. ठीक है, lignocaine. This is the other treatment. And we can also give phenytoin. ठीक है, phenytoin और lignocaine भी हम दे सकते हैं. Then Wolff-Parkinson-White syndrome. So there is a aberrant pathway, bundle of Kent. जो इसका permanent treatment यही रहता है कि हमें laser ablation उसको खत्म ही करना है. So laser ablation of bundle of Kent. Laser ablation of bundle of Kent. But we want to prevent the re-entry, so we can use drugs like propranolol, and we can use amiodarone, and emergency में flecainide also हम use कर सकते हैं. Coming to the blocks. Let's say there is a block, 2nd degree, 3rd degree की impulses नहीं pass और to the ventricles. So what to do? आपको opposite effect करना है, as मतलब block हो रहा है कि AV node से pass नहीं हो रहा. So you have to inhibit the vagal impulses in the AV node. So again you can give drugs like atropine or isoprenaline. But इसके लिए अगर आपको permanent में ये problem है, we have to do pacing. We have to give a pacemaker. That's the definitive treatment for this. So this is the summary of what are the different types of arrhythmias and how would you manage them. So very important for the MCQs, और अगर viva में पूछते हैं, so these are the important drugs to be used. Details हम already कर चुके हैं, but this is just for final. आपने go में ये पढ़ लो when going before giving an exam, so you know this. Tachycardia, beta blocker, bradycardia, atropine, PSVT, always remember adenosine, verapamil, drug of choice. Flutter fibrillation में we have to control. The primary thing is हमें rate control. Rate control करने का मतलब है आपको SA node पे करना है. तो SA node पे 2 ही drugs काम अच्छी तरह से काम करती हैं. One is this beta blocker and we have the calcium channel blocker. Ventricular tachycardia में जो ventricles पे effect करते हैं सबसे अच्छी तरह, that is lignocaine and amiodarone. Same goes for fibrillation. So remember fibrillation में definite treatment हमेशा defibrillator से हम defibrillate करते हैं because ये emergency है, patient can die. Torsades de pointis, magnesium, lignocaine, and Wolff-Parkinson-White syndrome. You have to prevent re-entry. We can use beta blocker, amiodarone, but definitive क्या रहता है इसमें आपके laser therapy से उसको हम destroy कर देते हैं. That जो accessory pathway है. And the heart blocks, that is, we can give atropine so that it doesn't allow the heart block. It will allow the passage of impulses. So that is opposite to that of the vagus. So this is all about your anti-arrhythmic drugs. So just go through these lectures again and revise them, and ultimately remember this table, and that is going to make your life much more easier, I'm sure. So thank you. See you in the next lecture. Till then, take care. Bye-bye.